Good afternoon. I'm Katie Hines, and we are speaking today with the Salvation Army Metropolitan Division's leaders, Lieutenant Colonels Lonneal and Patty Richardson. We'll be discussing poverty, especially poverty in our communities of color, and what the Salvation Army is doing to address the issue. This conversation is particularly timely as our nation continues to reckon with racism and its effect on institutions such as healthcare, housing, social services, and more. We're glad you're with us, and we invite you to submit questions in the Q&A function on Zoom. Viewers on Zoom can post questions there, and we'll be monitoring those questions throughout the conversation. If you're interested also in more information on how to support our programs, please reach out to your Salvation Army gift representative. Lieutenant Colonels, thank you for joining us today to talk about topics that are close to your hearts. Before we get into the meat of the conversation, can you tell us a little bit about your background?
Well, thank you for having us. We're glad to be here and for this opportunity. We have been officers for about 42 years, 38 of which we've been married, and we've had the opportunity to serve together. We've served as corps officers for 20 years. We've served on some divisional staffs and then moved into the position of divisional leaders down in Midland Division in 2007. We've had the opportunity to work with community leaders, church leaders, faith leaders, community activists, and all types of groups to help obviously serve those who come to the Salvation Army and to serve the community.
Yes, actually we were introduced, my family, to the Salvation Army. My mother worked for the Salvation Army, not as a Salvation Army officer, but as an employee for over 41 years. Working primarily with women who were homeless and individuals who was part of the homeless community. And it was through that program we saw not only the work of the Salvation Army, but how it changed the lives of people.
This conversation that we're starting today is poignant as we're only a few days out from Juneteenth. I know we learned that President Biden is going to be signing a bill into law in just a couple of hours, making Juneteenth a federal holiday. We also know that our divisional headquarters here at the Salvation Army will be closed tomorrow in observance. What is the importance of Juneteenth?
Well, I think it's symbolic not just to those of us who are in the United States, and especially those of us who are people of color, but it's symbolic for the world because we know that there are still nations where individuals are in human bondage. And so America is a beacon of hope and opportunity. We may not have all things together, and we in the Salvation Army believe that won't happen until we enter heaven, but we are an example to the world of what we can be when each individual is given certain opportunities that have been endowed by their Creator. And we as a country are a shining example of what we can do and what we can be when we look to each individual and the opportunity God has endowed them with. And so we celebrate that, not just here, as a beacon of hope and opportunities for around the world.
This last year has been an undeniably difficult one for so many with COVID, but you've actually said that our city is facing a twin pandemic. Can you speak to what a twin pandemic is?
Well, as we have all experienced in the last 15 months, experiences like we never thought, at least in the United States, we would experience. Every day, looking at the number of individuals tallying in the hundreds of thousands who lost their lives to this terrible disease without discrimination, both old, young, rich, poor, black, white, brown, but especially in a lot of our communities where we had some problems of health care that exposed the lack of opportunities for individuals to have proper health care and devastated our communities. At the same time, we also had some incidents that took place that brought to the forefront, once again, racial justice and a call for equality throughout our communities in America and literally around the world. And so the twin pandemic, one, COVID, the other one that we saw in the forefront was racial injustice in our communities. that we still struggle today with both are impacting our world around us. In 2020, I think it was February, at a public forum, Mayor Lightfoot said that poverty is killing us. And it was before the pandemic was actually publicized. And she said both physically and mentally throughout Chicago. She said that currently over 32% of individuals who are African American live in poverty. And I think those numbers are about 20+% in Hispanic and even in the Asian community. But throughout Chicago, 22% of individuals, and this was before the pandemic, was living in poverty. And we in the Salvation Army have only seen those numbers escalate. People who often donated to us found themselves struggling to feed their families or provide housing or even opportunities for internet services for their children and continue education. And so it has exposed some systematic problems that we face. But you know, we are a strong community. Chicago is a caring community. The Salvation Army has seen the generosity of individuals who've supported our mission. They may not wear the uniforms like us, but nevertheless, they are an army that is helping us do the most good in our community. And so we hope that we can continue to do that.
Yeah, I think the COVID, it just seemed like there was this convergence of COVID and the racial unrest and reckoning that our country is starting to face. And as you talked about and heard those numbers about Chicago, we have to remember we serve not only just Chicago, we serve outstate Illinois and down into Lake County, Indiana. So you can lay on top of those statistics the same thing that's happening in those outlying areas. And so everywhere we serve, we are seeing that without exception across our division, and talking with our counterparts in other divisions, they're seeing some of the same things too. And so this twin pandemic, while obviously it's in our backyard, it's also in our country, it's in our territory, it's in our country as well.
I remember the numbers from the height of the pandemic last year. We heard that some of our core community centers were seeing a 5-fold increase
Easily, yes.
in the number of people coming, especially for the food pantries for emergency assistance. One of the things that we're hearing now, I know we're watching that the eviction moratorium is going to be lifted both federally and here in the state of Illinois. How do we plan for that? What do you foresee happening when it comes to our clients and that critical emergency funding that we have?
Most likely, we probably will start to see some now increases in people asking for rent assistance. And I mean, that's always been an issue that's been there, and we've tried to help to the extent that we're able to do. Most likely, we anticipate that's going to increase as more people come and they need to pick up that back rent and things like, and to make those things meet. So we are trying to work with our local partners, our governmental agencies and other partners to try to help position ourselves to help where we can, to do what we can, and to continue, hopefully, to speak into policy. We want to be at the table with these decision-making groups, with these funders. We want to try to be at the table to be that advocate. We certainly don't have enough money to take care of everything, but we think we can help inform policy decisions. We think we can help inform spending where those things are going to happen. So I think just the Salvation Army being present will be helpful as well.
We've already been in talks with both the city, state, and other municipalities as it deals with the moratorium being lifted on evictions. In Chicago alone, we know that there are over 100,000 individuals, mostly families, who are housing insecure. If we were to combine all of our shelter beds that's available in Chicago at any one given time, it's a little over 10,000. And so, you know, we are concerned. Already the Salvation Army has worked both with the city and other agencies to put in place temporary shelters. Now, we were concerned during Christmas time, But now, all of a sudden, the last few weeks, we've had very high, dangerous temperatures, which is expected to go into the summertime. And we know that it is not safe for individuals who do not have access to air-conditioned spaces. And so we are already working on contingent plans of how the Salvation Army, along with its partners, can be ready to respond at any given time. Some of our donors and individuals may not know the Salvation Army also have a program where we check on senior citizens in their homes to make sure that they have proper heating in the wintertime and air conditionings in the summertime. We also bring them food or other medical supplies. Right now, as individuals have been able to receive their COVID shots, it's not as a big concern for their exposure to COVID. But during the height of the pandemic, we had Salvation Army volunteers and staff who provided medications, food, and other assistance to individuals who were shut in or our senior citizens. So our stakeholders who donate to the Salvation Army can be assured that we stand ready to help whatever the situation in our community arises. Last week or earlier this week, when the chemical fire took place, our emergency disaster teams of volunteers were out serving first responders, at the same time serving the communities of individuals who were evacuated. Your donation to the Salvation Army make that possible.
We already have a question from the audience. I'm going to read this off the screen here. How can the Salvation Army practically fight for justice and help communities fight against racism and exploitation like redlining and rent-to-own scams?
Well, I think the first thing we can do is to be there and available for individuals to come and to seek out help with the Salvation Army and provide honest information to them and assist them in the whole process. Our doors are open. We were open during the pandemic. We understand that there are barriers to individuals oftentimes in housing and other situations. We work with partners to identify what those barriers are, and in some cases we work with in legal means and municipalities to make sure that those barriers are dealt with in an appropriate and a way that the law would have us to deal with them.
Yeah, right, absolutely. Again, that being able to be that advocate where we're able to help speak on behalf of those who are maybe been a victim of redlining, and can we partner with some other agencies? And so local partnerships are important. Obviously, being able to communicate with our governmental agencies and other partners are important. It's a huge problem, but drawing attention to it is how we're going to begin to help change some of those things, and so we're able to do that.
Most individuals may have forgotten or not be aware that over 2 decades ago, the federal government had plans, quote, to end homelessness. In each state, as well as municipality and regional area, submitted plans on how we were to end homelessness in those days in the next 10 years. And so the Salvation Army continues to be part of those continuums of care, providing information both to our city, state, and federal government on real issues that we see as impediments to individuals not only having housing, but decent, affordable housing in our community.
Absolutely. You touched a little bit on the systemic inequities in our previous question about the twin pandemic. Going back to that a little bit, there are a lot of communities that are facing hardships due to systemic inequities, many already living on the margins. How did COVID compound the challenges in those particular communities, and what do you see as the long-term impact?
Well, about a month ago, we had a massive distribution of assistance to individuals, and this one took place at our Red Shield Center in Inglewood. And we were there for probably about 7 hours, providing both cleaning supplies and some practical things for individuals, but we provided clothes and we provided shoes through a donation of those items from individuals. And I remember this 5-year-old young boy. He kept staring at a pair of shoes and looking at them, and his uncle had brought him down for the giveaway. And then kind of sheepishly asked, well, you think I could have a pair? Now, we think about food and we think about the other things, but for him, and I looked down at his shoes, and they were well worn. They had seen their better days, and I don't know whether he received them new or whether they were a hand-me-down pair of shoes. But his whole demeanor changed when we handed him a pair of new shoes. And I think about that child and the effect not only of him going to school or in the community with worn, tattered clothing and shoes, but all of a sudden, his whole character and demeanor changed when he was given just a new pair of shoes. He is not the only child like that in our community, whether it's a coat, whether it is underwear that is going without. We have the opportunity to speak into this next generation of individuals to say that there is someone who cares. There is someone who is willing to buy you a new pair of shoes. And so we thank those who make that possible. That will make an impact in that young child's life, to know that we are a caring community, and he can depend on that community to help and assist him. In the Salvation Army, as we say in doing the most good, we are carrier of others' generosity. In that case, it was the generosity of someone who donated probably about 500 pair of new shoes for children.
Really a profound impact when you can see the change in a child's face. And it's also an example of one of the many programs that we have outside of what folks might know, the food pantries, the emergency assistance. There's so much more, and so much more that's tailored to the particular communities. Could you speak to a couple of other examples, perhaps from our Inglewood Red Shield Center or some of these communities that have been disproportionately impacted?
Well, one of the initiatives that Inglewood has started is a healthy food program. Inglewood, again, being a food desert, as many of the neighborhoods who are experiencing poverty are around our area. So they've taken it on to bring in fresh food, to work on food preparation and meal preparation, coupling that healthy living with exercise, because we have a facility there that allows for exercise. So exercise, education, and nutrition to begin to help show, to demonstrate, and prepare folks for living a healthy lifestyle and finding ways to make their food budget go as far as they possibly can, and to use healthy alternatives.
The needs that we're seeing right now as the pandemic continues, how are these different than ones we have seen for many years?
I don't think they're different. I think they are markedly. I think we're seeing glaringly how the disparity in those. I think we knew that they were always there. I think we are seeing the reality of those needs. We think about people who are hungry, and some people may say, well, this, that, or the other, but yet when you think about it in a country like the United States, for people to actually go to bed hungry, it's difficult for it to jive in our psyche, but those are true. We look at people who may be homeless. We look again like this young boy who just a pair of shoes, to be able to have that, and it seems so counter to what we see in our culture. I'm reminded of a story when we served in another division, but we've seen it even in places here at camp. Because we have camping programs for children and families and even adults, and he had gone to the swimming pool. That wasn't something that he'd ever been done before, and he was just, it's like getting him out of swimming pools, like trying to pull a fish out of water. He couldn't do it. But we told him it's time to go and eat, and his answer was, "I've already eaten today." And that was in the middle of the day. So no, here you get to eat 3 meals a day. And so when you begin to look at that compounded over and over and over and over and over again, it's just right, it's right in our face. We've always known it's there. Now it is right in our face. And, you know, we as the Salvation Army, we can't look away from that. We have to try to do what we can to try to address that and speak to that.
I also say that we've faced many challenges, and the Salvation Army has stood shoulder to shoulder in communities to address those challenges. For Colonel Patty and I, we served in Missouri when the tornado hit in Joplin, and we saw a community there totally devastated. A third of that city was destroyed in a matter of 40 minutes. And it had years of lasting impact that was there. And so in the Salvation Army, because of the generosity of our stakeholders and partners, we're able to respond at a moment's notice. I remember receiving a phone call about 5 o'clock in the afternoon after the tornado had hit Joplin. By midnight, we had already served over 1,000 people. As the Salvation Army canteens came in from Kansas and Oklahoma to that community providing services. And the Salvation Army responds when there is a disaster or when there is an unforeseen circumstance that cause people to need assistance. And so for some of us, we only equate that to those who are in poverty. But I can tell you, I've been at sites where disasters have happened in wealthy communities. And in the middle of the night, it doesn't matter what you have in the bank. It's, do you have someone who's willing to stand beside you and to say, it's going to be all right? And that's what the Salvation Army does, is we are willing to stand beside a person who's experiencing difficulty and to say, it's going to be all right. And we make that claim not because we have the resources, but the essence of the Salvation Army, we believe that God is faithful. And we call upon Him to give us the strength and the resources we need to respond to those needs at the time of need.
Absolutely, and we know the generosity of others is such a key part of that. Wanted to remind people who are watching right now, you can submit questions for the Lieutenant Colonels. We're monitoring them in real time. Just go to the Q&A function on Zoom. We do have another one. COVID-19 vaccination rates are lower in communities of color than in the overall population. What has the Salvation Army done and maybe is still doing to encourage COVID-19 vaccinations in members of communities of color and the homeless?
Well, I can say, once again, the Army is on duty in providing those. In Inglewood, we've partnered with the city, and I think as of today, on 3 occasions, the city bus that has been outfitted to provide COVID inoculations have been at that site on several occasions. Our La Villita Salvation Army location has also provided inoculations to individuals within that community. Our LON, again, in the Hispanic community, has provided inoculations at that particular site, partnering both with the City of Chicago as well as private healthcare agencies. Our Midway Citadel Corps on several occasions have provided inoculations. Beginning, we had the target groups that were identified by the state and the federal government. Now they're opening up in many of those locations for anyone who needs a shot can simply walk up and register and receive their inoculation. The Salvation Army has a senior high-rise, Booth Manor. All of our residents at Booth Manor was taken and received their inoculation down the street at the United Center. All of our programs, both at our Harbor Light, where our homeless population receive housing, as well as our shelters, have all been sites that we provided inoculations. But we find that it's not just providing the opportunity for individuals to have their COVID shots, but we also have been involved in training while it is important to receive your shot. And we unfortunately have seen individuals in communities that have lost their lives to this terrible disease or have spent many nights in the hospital. So our job is not just to provide an opportunity for individuals to receive their shots, but also as giving information of why it's important. We both, as an example, received our COVID shots, and we had those photographed, and we did some videos encouraging both our employees and our clients how important it was.
I think it speaks volumes to the trust that people have in the Salvation Army and the fact that they would trust us as a community partner and maybe someone they know too in the neighborhood. We had also just learned over this past week that our mobile outreach team and Lonneal Christian are partnering up to take vaccinations out to the homeless as well. So much going on there to really try and change those numbers on our account. It's clear that our cities and towns are going to continue to face extraordinary challenges. What is the Salvation Army doing to make sure that our most vulnerable neighbors don't fall through the cracks?
Well, we continue to make our effort, again, I think through those partnerships, our social services agencies particularly, making those partnerships, staying connected with those, sitting on those continuums of care so we know where the pockets of need may be in a particular community, so that where we are trying to get the resources out to those folks, whether it is through the program where we're knocking on doors to check on seniors, or whether we're enabling and sending out a mobile feeding or inoculation or information or whatever they may, a mobile unit to get out to those communities. And we continue as people come in for social services needs, whether it's food or whether it's utilities, continuing to provide information. Here's some resources that we've partnered with. Here's some other things that you can look at. And so a lot of it is information, and then serving and providing where we're able to do that provision.
I think the most important thing that the Salvation Army was able to do during this entire process was we stayed open. Our core units remained open to the communities to provide food and assistance and a listening ear. All of our institutional programs remained open. We work with partners to make sure that we provided the proper protocol for safety and providing PPEs for both our staff, volunteers, and clients, but we remained open. Our officers, I thank God for them. Many of them took on extra responsibilities of not only providing at their sites, but going out and providing for those who were homeless. Some of our units became shelters, temporary shelters for individuals because we had to do some proper distancing during that time of COVID. And so we had to, required us to have greater spacing between clients. Daily we were on calls with both the city, state, and federal agencies about proper protocol for working with individuals who were coming to us for assistance. And the other thing was, we thank God that while we had officers and staff that were exposed and tested positive, we thank God that they all recovered. And some recovered and returned to the same work because they saw the need. At some of our drive-through centers, when the community knew we were passing out food, there were lines of hundreds of individuals. And thousands. I recalled in one of our locations during COVID that we experienced, a senior citizen came and we had these boxes of food that had been packed enough that we thought for a week or 2 weeks. And I remember her trying to pick it up, and the staff said, "It's too heavy, let us," and she thought we were going to take some out, and she'd go, "Please, no, I'll do it." And the staff said, no, we're going to take it home for you. We're not going to take anything out of the box. We're going to take you home. And they did. They took her home along with her box because she was so afraid that if they took even one item out, it may affect her. And when they got to her house, she was living with someone else who was a senior. And so the Salvation Army have provided acts of generosity and kindness throughout COVID. We will continue to do that. We are the Salvation Army. And we believe that we're not doing this just to respond to COVID. We're doing this to respond to human need.
One of the points you brought up earlier was the importance of not only responding, but also being at the table with policymakers, both local, state, and federal. Why is that so important, and what can the Salvation Army specifically bring to those conversations?
Well, number one, the knowledge of working with individuals every day and seeing, we would say, ground level or at zero impact, and to say, here's what people need, and here's how we can distribute them. For instance, you talked about the moratorium being lifted on evictions. Well, in several of our communities, we work with both local and federal government to provide assistance and rent relief to both landlords and individuals. We have the infrastructure already in place, so we don't have to hire individuals to restart those programs so those dollars are distributed out. We are already in the community. When disasters happen, we're there. We have staff, and we have volunteers, and we are an army that's able to go to work at a moment's notice.
I think, too, being able to go and maybe get with a legislator where maybe someone in the community doesn't have that access. And so we are blessed that we have the opportunities to speak in person with policymakers, whether it's at the city, county, or state level, and bring those concerns, things that we've seen, like Colonel said, at ground zero. You know, we've rubbed shoulders with those people, so now we can take that and say, here's the experiences that our folks are having, and here is the impact that we are seeing as a result of those policies. And so let's talk about how we can do what we believe we all want to do, is help the people and help the communities. And so that's why that's just hugely important.
And you have experience and a track record of success when it comes to those partnerships.
Yes.
Can you speak to a couple of those examples and previous appointments that have gotten things accomplished?
Yeah.
One was my previous appointment right here in Chicago, when we were thinking about how the Salvation Army could partner with the city to provide services, and so we chose the Inglewood community. At the time, Wentworth Elementary School was the elementary school that was a part of that campus. And so we wanted to double the impact of what the Salvation Army would bring to a community by partnering with the city and the community that was already in place, and not necessarily trying to build a whole new infrastructure, but leveraging both private and public funding to build now the Red Shield Center. I don't know if individuals realize that one of the programs we partner with the city with is an alternative justice program, or restoration, where mainly for teenagers who are involved in behaviors that we want to correct. So instead of placing them into detention or starting into a lifetime incarceration, the whole court is for a alternative justice of them paying their debt to society, meeting with those they have wronged, coming up with a solution where they understand the impact of their actions, both in their community and on those who were offended. So the Salvation Army is looking at what can we do to change what we're seeing on the ground. So when we started that Red Shield Center, Now, most days throughout the week, there's a court taking place providing that restitution and community justice in a way that we feel will impact the lives of those involved.
We have another question. Let's see, going back to Juneteenth. In light of Juneteenth, what is the Salvation Army's history of combating racism and slavery?
Well, let me give you a personal story from my family. I had a cousin who, before even genealogy and so forth was this big thing, she received her master's in, I think it was social services, and so she did a family search, and we found that way back our grandparents, which most African Americans know, were slaves. But we found out how we received our name Richardson as my great-great-grandfather, and this was a story told to me by my grandfather, had been passed down. After slavery had ended, and most African Americans only had a first name, and so some took the last names of their slave owners or other names. He was going through a cemetery, and he saw on a tombstone someone with the last name Richardson, and under it said, "A man of valor, a man of great respect and honor in his community, loved by his family and his friends." And he looked at the name, and so from that point on, we took the last name Richardson. So even in that time, he probably had no idea that one of his generations would be sitting at a table like this. And so I think we can't though stop and just say one of us is sitting at the table and opportunities are there, but we must provide a pathway where others can see that they too can not only remember the past, but they can celebrate a future of hope. And I hope that with Colonel Patty and I sitting here as representing the Salvation Army, that we represent not only the hope that the organization provides to individuals, but more importantly, the hope that we believe God provides to each of us as his children.
You know, internationally, the Salvation Army, the international leader of the Salvation Army, has spoken very clearly about the need for the Salvation Army to recognize the part that racism may have played in society and unfortunately even in some of our own history, and to address that. And so the General has written very clearly. There's an international task force that has set some guidelines and principles that we are working on and working toward enacting even within the territory. And our territorial leaders, we understand that our future is tied up in the well-being of all the people who come to us and who are around us in the communities that we operate in, irregardless of who they are or where they live, that they have a opportunity to minister and to serve and to come alongside and work, and that we are stronger together. And when we're able to see each other's differences, recognize them, learn from them, and then turn around and serve the community. And so the Salvation Army made up of imperfect people, yet we are focusing on the goal, if it were, our eyes on the prize of being an organization that there is a place for you, whether you come from the Hispanic community or from the Hmong community, for wherever you may come from, where there's a place of opportunity and service. And so that's our long-range goal as an organization.
How can our donors help keep all of our programming going?
Well, number one, there are kind of a threefold thing we need from all our donors: time, talent, and treasure. Each one is important to the mission of the Salvation Army. Time, volunteer. Go down firsthand and see how your donations are being utilized to impact the community. We have probably near any of your homes or programs that could use your assistance. And as we come out of the pandemic, we hope that our volunteers will return because they are needed to give our staff a break as well. And then talent. There are individuals who have certain expertise that can help us and provide a better way of delivering services to those who come to us in need. Or they may have a talent they want to share with clients. Like we talked earlier about the culinary arts program that we had with clients. Maybe you have a favorite recipe or something else you would like to share with some of our clients, and so we have opportunities for you to do that. And then the one that we depend on to carry our mission forward is treasure. Donations, great and small. Whether it's at a Christmas kettle with a little child dropping in coins, or I remember as a kid growing up, I would stand kettles as part of the volunteer that all of us as teenagers had to do. And I remember I grew up in Memphis, Tennessee, and Elvis Presley always wanted to put his own donation in the kettle, but he didn't want to do it as Elvis Presley, so he would dress up in costume and he would make his annual donation, and at that time it was a check about $25,000. And in the evenings we would come in and they would count the kettles, and all of a sudden it was a surprise to have a kettle with a check in it, and it said Elvis Presley and it $25,000, and then you're trying to figure, who was he? You know, which person that was there. I think many of our donors are like that. They're unknown, but their gift has made such an impact on the work of the Salvation Army. And we may not know who they are, or the donor or the recipient may not know the donor. But I can tell you, in the 40 years, those donations are as important and impactful as a donation that the king of rock and roll made every year to the Salvation Army.
We'll put out another call. If anyone in the audience is watching and has any more questions for the Lieutenant Colonels, thank you for the ones already submitted. Please feel free to submit those via the Q&A function on Zoom. Any other topics that you'd like to discuss? We have a few minutes left over while we're waiting for some questions from the audience too.
We are concerned about housing. As we've talked about, there's over 100,000 families and individuals who are housing insecure in our city alone, and we know that the rising cost of housing is problematic. At the same time, the low number of affordable housing that are being built to accommodate those who need housing. Oftentimes we have individuals who come to our shelters, and the difficulty we have is finding permanent housing for them. And so the Salvation Army will continue to work with both state, federal, and other agencies to develop new affordable housing that we can refer our clients to, as well as initiate some endeavors in places in the city that we need to address the stock of available housing. That is the only way that we truly can do the most good for those that are there. We love our shelter programs, and for a family who's homeless, there's nothing like having a safe place to go and to be provided for. However, there's nothing like a place that you can call home. There's nothing like a child having a bed they can call home. We also, in our short time coming back to the Chicago area, have found that there are literally tens of thousands of children every night who go to bed in a different place or without having permanent housing. They're in our schools. Now imagine, we realize that our schools were closed for a large period of time. Now they have slowly opened up. but we were concerned about those children. And where were they staying, and when did they receive that one meal that they received at school? Where was an adult watching for the children who are in an abusive situation, or children needing a accountable adult to talk with? I think we're going to experience the mental health effects both on children and adults long after we have dealt with COVID.
Yeah, that's true. And one of the things, speaking of children, and we're pleased this summer that we're going to be offering some day camps across our division, reaching out to some of those school children, people who maybe have been affiliated programmatic-wise with human or youth programs before, but also we've already starting to get applications from a lot of those who've come to us for maybe social services needs, are finding that they also want to have their children involved in this programmatic aspect that will provide education and recreation, and a caring, well-ran, safe environment. So we'll be doing some day camps in some local communities around our division, and then we'll also be offering those young people opportunity, actually the whole family, an opportunity to go to camp and spend some time at camp. And we already know, as you know, part of the camping community, how therapeutic and how important it is for those kids and those families to get out, get away from what they have been experiencing, get out to an outdoor setting camp and just have that opportunity for that respite, for that momentary break to relax and to begin to recenter and to refocus and understand that there are those who care for them and have an opportunity to hear messages of creation and inspiration and positivity that will help them begin, because when they get ready to go back and hopefully getting back into school, they will have had that opportunity that will begin to help build into their mental well-being. And so we are excited that we're able to begin to operate and open those programs up as well, following COVID protocols as need be, but again, giving them this opportunity and this experience. So we're excited for that this summer.
Yes. And donors have made those possible.
Oh, yeah,
Chicago, we have a Chicago Kroc Center by the generosity of Joan Kroc and Ray Kroc. He was from Chicago here, but their legacy goes on because they knew that the Salvation Army could be trusted. Not only with their donation, but to build a place where individuals could maximize their God-given opportunities. At the camp that Colonel Patty talked about, we have a facility named after a donor there who helped make that possible. Most individuals may not know the Salvation Army initially received that property as part of Will Rogers' donation to the Salvation Army. And he had an interest in children, especially those who did not have an opportunity to be in the outdoors, to experience all the outdoors had. There's nothing like being in a place and looking up at the stars and knowing they didn't just all of a sudden appear, that there's a creator. All of nature cries out that God, and there's someone who designed it all. And what we tell the people is, as beautiful as all those stars are, as beautiful as the trees, the lakes, and everything else, you know what his crowning creation was? Is you. You know where he spent the most time and he created in his own image, as we believe? Is you. You are more important to him than the beauty of the stars and the galaxies far, far away. And so for a child, and sometimes for an adult who's never heard that, it has an impact. And so we thank those who are generous to help the mission of the Salvation Army, to let individuals know that you have a wonderful creation, but you're God's crowning part of his creation. And maybe that can deal with some of the issues we've talked about, of racial injustice, of trying to rebuild your life after you've lost a loved one to COVID, trying to understand what was this last 15 months really all about, that God cares, that He is there, and He is willing to walk alongside of you.
Lieutenant Colonels, thank you both so much for your time today and for this wonderful conversation. Thank you for joining us, and if you would like to support any of our programming, please reach out to your Salvation Army Leadership Gift representative.